Please indicate if you can't hear me speaking, and we'll see what we can do about it. So back in January 2020, we were facing a huge crisis in health and social care in the country, with very high levels of staff turnover, intention to quit, vacancies, and the very highest levels of staff stress we had seen for some time. And those problems had been increasing over the previous few years. So when we think about the coming months and years, I think it's really important that we think not simply about how we emerge from this global pandemic, but how we transform our health and care organizations for the future. And that's about culture, of how we transform cultures. There is real wisdom, I think, in going back to the moment when the welfare state, the NHS, was created in the United Kingdom back in 1948. It was a commitment to create services that would provide high quality care, compassionate care for everyone who needed it, regardless of wealth or status or prestige or background or skin color or sexuality or abilities. In short, it was a commitment to create a compassionate and inclusive society. And compassion, I think, is what has helped us cope during this last 16, 17 months with this global pandemic. The compassion that staff have shown for patients and service users and for each other, and the compassion that the community has shown for people. Over 750,000 volunteers to support the NHS, the volunteers in the vaccination program. You know, the people who kept calling in on my 95-year-old mum to see if she needed shopping or help in any way. Compassion is what enables us to feel safe and a sense of belonging, a sense of connection, particularly in difficult times. And what we always see in human disasters is an upwelling of compassion from our communities. Compassion is something 99% of us are hardwired to show in times of difficulty or when we encounter people who are in pain, suffering, or in fear. And we know a lot about compassion in terms of human behavior, how, to pick up on what Ronke was saying, it increases a sense of belonging and connection, and belonging is so important to us as human beings. We know that when people are asked to be simply empathic to those in pain, that's associated with the activation of pain centers in the brain. But when we're asked to be compassionate towards somebody in pain or fear or distress, that's associated with the activation of reward centers, because we're hardwired, as I say, to connect, to care, to help, to be altruistic, to be compassionate. And we know in healthcare that compassion is probably the most important intervention there is across the board, whether it's anaesthetists visiting patients prior to surgery and being extra compassionate, and that's associated with a lower requirement for patients post-surgically for painkillers and a shorter length of hospital stay. Or people with an early diagnosis of non-small cell lung cancer receiving early palliative care in addition to normal early cancer care, extra compassionate care if you like, and the surprising finding they live over 30% longer. When clinicians show compassion to those with long-term disorders like diabetes and HIV, the outcomes are much better. And when clinicians are compassionate to people with mental health problems, there's much better outcomes. And clinician compassion also has an impact on nurses and doctors themselves. So when they're asked to show compassion, their anxiety, stress, and depression declines over time. And the effects are remarkable, greater than the effects of aspirin in the treatment of heart attacks and of statins in the 5-year risk of a cardiovascular event. And inclusion was a fundamental value of the NHS, the welfare state. And inclusion and compassion are like two sides of one hand. They're both about blurring the boundaries between self and other. They're both about connection and belonging. And inclusion is important morally, of course. We know that It also is important in terms of health. If children are excluded from their friendship groups in the playground, it has an impact on inflammation of the central nervous system. When people with disabilities are discriminated against, there are long-term effects on their health. People from minority ethnic groups discriminated day in, day out, it has an impact, a biological weathering effect, if you like. And diversity and inclusion are performance effects. We know that diverse teams and boards, primary healthcare teams, community mental health teams, executive teams, organizations, when they have positive climates, are much more productive, innovative, creative, effective than more less diverse or homogenous teams. So inclusion and diversity are not only moral issues and health issues, they're performance issues. And every individual in the health service should have a working knowledge of the research evidence on the effects of discrimination on health. And every leader should have a knowledge of the positive effects of diversity on performance. It's therefore about how we transform cultures in the NHS to ensure that they embody those values of compassion and inclusion that were at the core of the creation of the welfare state. And of course, for every one of us, every interaction in our work organizations every day is an opportunity to shape the culture. How warm we are, how kind we are, how irritable we are, how compassionate we are, how inclusive we are, the ripples spread out and shape culture. But we must ensure that compassion and inclusion are part of every process that we use: selection, recruitment, promotion, appraisal, performance management. They must be built in, those values, to the processes in our organizations, like the DNA of the organizational body. And the program, the culture and leadership, the culture transformation program developed by NHS England and NHS Improvement, which I've had huge privilege to be involved with, is precisely the way we bring about that change. And now is the moment. After all we've been through this last 16 or 17 months, now is the moment when we must seize take advantage of the momentum and transform the cultures of our organizations. We can't go back to where we were in January last year, and each of us can take responsibility for transforming culture in how we behave in our work lives and in our personal lives, embodying compassion and inclusion in the way that we behave to others, attending, listening with fascination, understanding, empathizing and helping. The role of the NHS and health and social care is, I believe, these institutions are the most powerful in our society. If all of the 1.4 million people who work in the NHS go into work every day and encounter cultures that are compassionate and inclusive, they accrete those values, they take those values out back into their communities and their families. And if the 1 million people who use NHS services every 36 hours encounter compassion and inclusion, they take those values back out in their behavior into their families and communities. So there's no more important institution in our society than our health service in England in transforming our society as a whole to be more compassionate and inclusive in the future. And it's what we desperately need. Thank you. And now over